Now we come to fasting state or starvation. Suppose I locked you in a room and I'm not giving food for 16 to 18 hours. Then your liver will say, don't worry, I can maintain blood glucose up to 16 to 18 hours. That early fasting means 16 to 18 hours, and liver glycogen is sufficient to maintain blood glucose up to 16 to 18 hours by glycogenolysis. I mentioned liver glycogen. Why not muscle? Muscle glycogen can't contribute blood glucose, can't contribute blood glucose. Mnemonic. Muscle is selfish. Muscle says myself, my glycogen I will use, I will not give to blood. But liver says, okay, I will maintain blood glucose up to 16 to 18 hours. Yes, muscle can't contribute blood glucose. Muscle is selfish. Muscle says myself. This question was asked. A person who had dinner at 8 p.m. previous night tested his blood glucose level at 7 a.m. next morning, 11 hours. What is the source of blood glucose in this case? Yes, hepatic glycogenolysis. Suppose I locked you in a room and don't open up to 48 hours. Up to 48 hours. Yes. Then I will say you are in fasting state. Liver will say, don't worry. If glycogen is depleted, don't worry, I will make new glucose. So liver will do gluconeogenesis, and liver can maintain blood glucose up to 48 hours by gluconeogenesis. At the same time, liver will start beta-oxidation of fatty acid. Means in fasting state up to 48 hours, predominantly gluconeogenesis is there, but beta oxidation also start. Remember, question is asked, in fasting state or starvation? Yes, in fasting state, insulin decreases and glucagon increases. So hormone of fasting state is glucagon. This glucagon activate hormone sensitive lipase. Lipase will cut lipid, triglyceride, and triglyceride will be cut and fatty acid will be released. This fatty acid will enter the mitochondria and beta oxidation start. So I can say in fasting state, beta oxidation start and produce energy. That energy is used by this gluconeogenesis, but our main concern is to produce glucose by gluconeogenesis up to 48 hours. After 48 hours, up to, yes, 2 to 5 days, 48 hours to 5 days. Yes, we say prolonged fasting or starvation. Yes, in prolonged fasting or starvation, liver is tired, now can't do gluconeogenesis so effectively, substrate are used. Now liver will do predominantly beta oxidation of fatty acid. Some amount of gluconeogenesis also present. We found that liver is having plan B. Liver knows that it's a prolonged starvation and our vital organ, brain, heart, and skeletal muscle can utilize ketone body. You know, ketoacidosis is a very toxic condition. Why our body is synthesizing ketone body then? Because our body knows that most vital structure, brain, heart, and skeletal muscle utilize ketone body in starvation. So plan C of liver is that if gluconeogenesis is decreasing, then this beta oxidation will increase and will start ketone body synthesis, and these ketone body will be utilized by most vital structure in our body. So now I can say that this circle is mitochondria. This circle is mitochondria. And this beta oxidation of fatty acid occur in mitochondria. Ketone body synthesis occur in mitochondria. Ketone body utilization occur in mitochondria. Gluconeogenesis occur both in mitochondria and cytosol, but gluconeogenesis start in mitochondria. Point it out. Gluconeogenesis start in mitochondria. These pathways are occurring in mitochondria, and this glycogenolysis is outside the mitochondria. So this is occurring in cytosol. This is occurring in cytosol. And you know that glucagon is a hormone of fasting or starvation. So all these pathway means glycogenolysis, beta oxidation of fatty acid, gluconeogenesis, ketone body synthesis are activated by glucagon. Point it out, all these pathways are activated by glucagon. Now I can summarize which pathway occur in mitochondria, which pathway occur in cytosol. There are two techniques. Either you make mnemonic, you will forget. If you remember this complicated pathway, just revise once more. You will find that most of the question, integrated question, can be solved this integration. So you can't skip that.